I'm Ben Gonzalez, and this is TDI. Well, normally open enrollment comes in the fall, usually from November to December, and that's when you can buy an ACA health plan through the federal marketplace. But because of the COVID pandemic, there's actually going to be a special open enrollment period starting this week and running through May 15th. So joining us to go over some of the details is Misty Highnote from our Public Affairs Office. Hi, Misty.
Hi.
So what's different about this special open enrollment period? Can anybody get an ACA plan now?
Right. So through May 15th, anyone can buy insurance. If you already have a marketplace plan, you can change your insurance plan. Maybe you bought one in the fall that you're not happy with. You can change it up.
That's awesome. So do you need any kind of special documentation to show that you qualify right now?
No, normally during a special enrollment period, you do. You need to prove that you either moved, got married, had a baby, lost a job. But since the special enrollment period's for anyone, you don't have to have documentation for any of that. And you can also go online to select a plan. Usually you have to call during a special enrollment period, but right now you can go online to healthgare.gov. There's still the call option if you want that too.
So it really is kind of an open enrollment again. And you mentioned people that may have lost a job or may have had their hours cut back severely. We know the service industry is hit very hard right now. Is there help to pay for this coverage if they need it?
There sure is. There's still the subsidies that you would normally get during the open enrollment period. You can see if you apply for those, that'll help you with the coverage. And that's a benefit of buying a plan through healthgare.gov instead of just calling up an insurance company directly, is that you can get those subsidies if you go through healthgare.gov. And if you already have a marketplace plan and your income has changed or you've lost a job, then you can go to your profile on healthgare.gov and see if you qualify for a higher subsidy. That might give you some more help.
That's always a good idea if your income changes at all. But this is kind of a redo period. Like you said, you can also change plans now, which is really unique. So normally during open enrollment, plans always start at the beginning of the year. How are they going to do it for this kind of special enrollment period?
Right. Important question. You want to know when your coverage starts. Right. So after you get all your paperwork done, you've chosen your plan. The month after that, on the first of the month, that's when your coverage is going to start.
Okay. So whenever the month that you sign up, the next month it begins at that point.
Right.
Okay. So if somebody has questions about ACA plans or just in general how this works, where can they find some help?
Right. You can go to healthgare.gov and there's some information on there. You can also go to us if you have questions about insurance in general. You can go to our website at tdi.texas.gov. Call our helpline at 1-800-252-3439. We also have a great shopping guide that'll give you some great things to consider when you're buying a health plan.
Okay. So, but for the healthgare.gov, there is a place to get local help, right? If they need help kind of deciding which plan is right for them.
Right. Yeah, you can go to healthgare.gov and there should be a find local help option. And there's people in your area, they're called assisters, and they can help you find the plan that works best for you.
Excellent. Okay. Any last tips when you're faced with all the gold and silvers? What should you look at for selecting a plan?
Right. There's some general tips that you always want to think about. People usually look at the price. I mean, that's kind of there in your face. When you're buying any big purchase, you look at that price. But you just need to know there's a lot behind that price. So that's your premium. That's what you're going to pay every year. But you also want to think about your copay. That's what you're going to pay every time you see the doctor. So these will be listed there. You just want to look at those, see what works for you. If you want a higher deductible plan for a lower premium, just know there's going to be that cost difference that you're going to have to pay out of pocket. So look at that. Another thing we urge people to look at is their choice of doctors. So you might have a doctor or specialist you really like now, and sometimes plans will require you to use doctors in their network. So you can check ahead of time to see if your current doctors are in the plan's network that you're looking at. You want to make sure that you're okay with that. Either they are or they aren't. And the same thing with your medication, your prescriptions. You want to make sure that they're going to cover those and that they're going to cover them at a price that works for you. So even though you see that premium, there's a lot of stuff behind that you want to consider to see if that price works for you.
That's right. So those are great tips for anytime you're shopping for health insurance, but we did want to tell people about this special enrollment period. Well, thanks. That's a ton of information. I hope people caught all that.
Yeah, right. And you could go to our website. We have a great health plan shopping guide there. So you can see some questions that you should ask before you buy health insurance. That's on our website at tdi.texas.gov. And if you have any questions about insurance, give us a call on our helpline, 1-800-252-3439.
All right. So Misty told you there, check our website for more information, tdi.texas.gov, especially for health insurance right now, but all kinds of insurance information there available on the website. And you can also talk to one of our experts there on weekdays at the helpline, 800-252-3439. So for Misty High Note, I'm Ben Gonzalez. This is TDI.